Good day, everyone. My name is Dr. Mabandla. I'm a doctor at Match. Welcome to our Ask the Doctor series. Today, we'll be continuing our discussion on tuberculosis. What are the risk factors for TB? The higher risk groups for developing TB includes, amongst others, people living with HIV, children under the age of 5 years, healthcare workers, close contacts of TB patients, people that have had TB within the past 2 years, socially vulnerable groups like the elderly, substance abusers, the homeless, prisoners, weakened immune systems, for instance, diabetics, patients receiving chemotherapy. How do you get tested for TB? If you experience any symptoms of TB or were in close contact with someone who has TB, you should go to your nearest clinic or doctor to be assessed. The healthcare provider may decide to test you for TB. The main test used to diagnose TB in South Africa is called the Gene Expect. It is a very accurate laboratory test which is able to give results within 24 to 48 hours. Gene Expert can also diagnose if the TB you have is drug sensitive or drug resistant. A second test, called the Mantoux test, is a skin test that is used to diagnose exposure to TB bacteria. This is particularly helpful in diagnosing latent TB. Other tests used to diagnose TB include X-rays, ultrasound, and tissue biopsies. How is TB treated? If you have latent TB infection, you may have to take medication for about 6 to 12 months to kill the inactive TB germs and prevent you from developing TB disease. The decision about taking treatment for latent infection will be based on your chances of developing TB disease. The medication used will be determined by what type of TB the suspected source patient is having. The medication used to treat active TB and its duration is determined by whether you are having drug-sensitive or drug-resistant TB and what part of the body is infected with TB. TB treatment can involve taking a number of TB tablets every day for a minimum of 6 months or to a maximum of 24 months. Your treatment will be discussed with you by your healthcare provider. It is very important that people who have TB disease take their medication every day as prescribed by the treating doctor or nurse. If you stop taking the medication too soon, you can become sick again. If you do not take the medication correctly, the TB bacteria that are still alive may become resistant to the TB medication that you are taking. TB that is resistant to some of the TB drugs is harder and more expensive to treat. It is therefore important that TB patients also have a family member acting as treatment buddy to help and remind them to take their treatment, to even observe them during their taking their tablets, called directly observed therapy or DOT. Thank you very much for tuning in. If you find this video informative, please like and share it and leave your comments and questions below.